Safety Toolbox Talk number 266. Common injuries and first aid. Common injuries can happen in various situations, from accidents at home to workplace hazards or recreational activities. Below are some frequent injuries and appropriate first aid treatments. 1. Cuts and scrapes. Description: these injuries involve damage to the skin, ranging from shallow abrasions to deep wounds. First aid: wash hands to avoid infection. Clean the wound with running water and mild soap. Apply an antiseptic solution. Cover the wound with a sterile bandage. Seek medical attention if the cut is deep, won't stop bleeding, or shows signs of infection. Two. Burns, thermal or chemical. Description: burns can be caused by heat, chemicals, electricity, or radiation, with varying degrees of severity. First aid: for minor burns, first or second degree, cool the burn under cool, not cold, running water for 10 to 20 minutes. Cover with a sterile gauze or clean cloth. Do not apply ice, butter, or ointments. For major burns, third degree, do not attempt to remove burned clothing. Cover the area with a sterile dressing. Seek immediate medical attention. For chemical burns, rinse the affected area with cool water for 10 to 20 minutes. Remove any contaminated clothing. Seek immediate medical help. Three. Fractures, broken bones. Description: a fracture is a break in the bone, which can range from a small crack to a complete break. First aid: immobilize the injured area using a splint or sling. Avoid moving the injured person unless necessary. Apply ice packs to reduce swelling. Seek immediate medical attention. 4. Nosebleeds. Description: bleeding from the nose can occur due to trauma, dry air, or irritation. First aid: sit upright and lean slightly forward to avoid swallowing blood. Pinch the nostrils together, just below the bridge of the nose for 5 to 10 minutes. Apply a cold compress to the nose or back of the neck to help stop the bleeding. Seek medical care if the bleeding persists for more than 20 minutes or is caused by a head injury. Five. Choking. Description: choking occurs when an object or food blocks the airway. First aid: Heimlich maneuver: stand behind the person and wrap your arms around their waist. Make a fist and place it just above the person's navel. Grasp the fist with the other hand and perform quick, upward thrusts to expel the object. Repeat until the object is expelled or the person can breathe. If the person becomes unconscious, begin CPR and call emergency services. 6. Insect bites and stings. Description: bites and stings from insects can cause pain, swelling, and in some cases, allergic reactions. First aid: remove the stinger if present by scraping with a flat object. Clean the bite or sting area with soap and water. Apply a cold compress to reduce swelling. Take antihistamines for mild reactions. Seven. Head injuries, concussions. Description: a concussion is a mild traumatic brain injury caused by a blow to the head. First aid: Keep the person still and calm. Apply a cold pack to any external swelling. Monitor for signs of serious injury like loss of consciousness, confusion, or vomiting. Seek medical attention if symptoms worsen or persist. 8. Heat exhaustion/heat stroke. Description: prolonged exposure to high temperatures can lead to heat exhaustion, and if untreated, heat stroke. First aid: move the person to a cool, shaded area. Have them drink water or an electrolyte drink. Apply cool, damp cloths to their skin. For heat stroke, signs include confusion, seizures, or unconsciousness. Call emergency services immediately and cool the person down rapidly with ice packs or cold water immersion. Thank you.